All right, today we're going to dive into the modern playbook for tackling two conditions that are, well, often a package deal: type 2 diabetes and chronic kidney disease. And this isn't just some textbook stuff, we're going to see how this strategy plays out in the real world.
So, this is really the core question, isn't it? I mean, when a patient is staring down the barrel of both heart and kidney failure, what's the right move? Turns out, it's not about one single decision. It's a careful, calculated strategy. Let's see exactly how that works.
To really get a feel for this, we're going to follow one patient's journey, step by step. By walking through her case, from the initial numbers all the way to her optimized treatment plan, we can see how clinicians are using the latest science to literally change people's lives. First up, let's meet our patient, because to understand the strategy, you first have to understand the person and, the specific risks she's up against. So, here's the situation. Our patient is a 62-year-old woman. She's been dealing with type 2 diabetes for more than 10 years, but now things are getting more complicated. She's got progressing kidney disease and high blood pressure. Plus, her desk job means she's not moving around a lot. You put all that together, and you've got a really serious medical challenge on your hands. And her lab numbers? Well, they tell a very clear story. Her A1C is 8.2%, which means her blood sugar is running way too high. That eGFR of 36. To put that in perspective, her kidneys are only working at about a third of what they should be. The UACR shows her kidney filters are damaged and leaking protein, which is a big red flag. And a BMI of 30 just adds to the overall risk. This isn't a maybe problem, this is an urgent situation. So the number one goal here, the top priority, isn't just to get her blood sugar down. It's a race against time to protect her two most vulnerable organs, her heart and her kidneys. Okay, we know the goal, so where do we even begin? Let's get into the strategy and see how that first, absolutely critical decision gets made. This is a huge decision point for the doctor. The patient's already on some meds, like metformin, but clearly it's not enough to stop the damage. So what do you add to the mix? What's the one thing that's going to make the biggest possible impact on her heart and kidney risk right now? And this is where the modern playbook really shines. Sure, other drugs could lower her blood sugar, but the latest guidelines point straight to a class of drugs called SGLT2 inhibitors. Why? Because these drugs are a total game changer. They do way more than just manage glucose. They are proven to directly protect the heart and kidneys in patients just like her. It's a targeted, powerful first move based on solid evidence. But listen, medication is never the whole story. Not by a long shot. The strategies that really work are holistic, combining the right drugs with fundamental lifestyle changes. So, at the same time she starts the new prescription, she gets this crystal clear lifestyle plan. First, limit sodium to help lower blood pressure and that protein leak from the kidneys. Second, watch the protein intake so you're not overworking those kidneys. And third, aim for about 150 minutes of moderate exercise a week to get the whole metabolic system healthier. Every single recommendation has a very specific protective job to do. Okay, fast forward 3 months. There's definitely been progress. Her condition is stable, which is great news. But, and this is a big but, there's still a warning light flashing. That protein leak from her kidneys, the albuminuria, it's still there. And that means the risk isn't fully controlled. The strategy needs another layer. And that brings us to the next tool in the kit, a non-steroidal mineral corticoid receptor antagonist. It's a mouthful, I know, so let's just call it an NSMRA. Think of it as a newer type of medication designed to be layered on top of everything else to give the kidneys an extra shield of protection, especially when that protein leakage just won't quit. But as you know, in medicine, especially with complex cases like this, the path forward is rarely a straight line. The plan is about to hit a little snag, an unexpected but totally manageable setback. So, 4 weeks after starting that new NSMRA, a routine blood test comes back with this number, 5.6. This is her potassium level. And for a patient with kidney disease, anything over 5.0 is a red flag. It needs to be dealt with right away. What's happening here is a condition called hyperkalemia, basically dangerously high potassium in the blood. And yeah, that sounds scary, but here's the thing. It's a known potential side effect of the very meds that protect the kidneys. Doctors are totally prepared for this. The key is not to panic, but to have a clear response plan. And here is that plan. It's calm, it's methodical, just 4 simple steps. 1, you temporarily pause the new drug, the NEM-STAR MRA. 2, you review her diet and other medications just to make sure nothing else is contributing. 3, you recheck her blood levels until they're back in a safe range. And finally, 4, you restart that protective medication but at a lower, safer dose. See? This is adaptive medicine in real time. All right, with that setback successfully managed, our patient is back on track. Now it's time for the final push to really optimize her treatment and get the best possible outcome. And look at this. The next follow-up shows fantastic progress. The adjusted plan is absolutely working. Her A1C has dropped, and she's lost 6 pounds. These are clear, positive signs that this multi-layered strategy is having a real impact. Now, this is great, for sure. But good isn't the finish line. While her A1C is better, it's still above the ideal target for many patients. There's still an opportunity to dial down her long-term risk even more. The playbook has one more move. And that final piece of the puzzle is another powerhouse class of medication, a GLP-1 receptor agonist. This addition is just a perfect fit for her remaining needs. It's great at lowering A1C, it adds its own layer of heart protection, and it helps with weight loss. It just checks all the remaining boxes. So let's just recap this whole journey. It started with identifying her high-risk profile. Step 1 was adding that SGLT2 inhibitor for core protection. Step 2 was layering on the NSMRA and expertly managing that potassium bump. And step 3 was adding the GLP-1 agonist for that final push. The outcome? Her risks are managed and she's down a total of 14 pounds. That is a huge win. Ultimately, this patient's story really shows us that managing chronic disease today isn't about finding one single magic bullet. It's a dynamic, personalized strategy of layering protective therapies, monitoring the results, and adapting the plan as needed. It's smart and it's effective. You know, this case represents the cutting edge of care today, but it really makes you wonder, right? As our tools and our understanding get even more sophisticated, what's the same treatment journey going to look like in another decade? How much more precise and personalized can we get? It's pretty exciting to think about.